Hello and hello and welcome to your plan year 2020-2021 benefits presentation. My name is Janelle and I will be your presenter today along with Rachel here from IQBA. We hope you enjoy this presentation and get a lot out of it.
So we're excited to kick off our 18th annual open enrollment this year. As displayed on the screen, you can see several other member institutions that are going through this process at the same time as you. So thank you very much for being a member of IQBA.
We'll start off first with a sneak peek of what we'll be reviewing with you today. First up on the left-hand corner, what's new for April 2020. We do have a low increase in your medical premiums. We had some Rally program enhancements with the introduction of the physician's results form. We'll talk about the flexible spending account elections, dependent verification, and how you can confirm your personal phone number and email address to be entered into a prize drawing. On the right, we'll also review some of these same great benefits that you currently have, such as the single sign-on, Surgery Plus, Teledoc, the IQBA Cares Pharmacist Advocate Program, the health management resources, the Blue Cross and Blue Shield mobile app and tools, and also employee assistance. We'll also review some of the medical prescription through Optum, medical through Blue Cross and Blue Shield, Aetna Behavioral Health, Symetra Life and Disability Plans, and we'll also review some open enrollment housekeeping with you.
So as we mentioned last year, IQBA is a self-funded medical plan, which means all claims processed by the medical, pharmacy, and behavioral health benefit managers are paid with premiums collected and reserves built up over the years. Those premiums collected and the reserves are built up with the premium dollars that you submit through your paycheck each pay period. Those premium dollars are saved for the exclusive benefit of our members, so the bills that are paid from Blue Cross Blue Shield, Aetna, and Optum are ultimately charged back to IQBA, and we pay the big bills using your premium dollars. So the premium dollars are used only for the benefit of our members and the claims that you guys are processing and receiving. Our plans are designed by educators for educators. We meet monthly in Orlando to review the plans and any enhancements or takeaways that any adjustments that we can make. And we hope that you see some of those adjustments, especially in the form of the Rally program this year. IQBA wants to invest in a long-term culture of well-being so you can be the best version of yourself. And thanks to your good utilization of the plan last year, we're pleased to bring to our members a low increase for the coming plan year.
First, we'll talk about the Blue Rewards powered by Rally program enhancements. The Rally survey is still the gatekeeper this year, so you will need to complete that before you see any of your Rally dollars on your portal. But we'll talk about some program enhancements, the wellness exams. This year, the incentive is $60. That's an increase from $25 last year. The biometric screenings also increased to $40, up from $25. And then for your on-site or campus events, they're still $10 each, but now you have a chance to participate in up to 7 events for a total of $70 in incentives. We still have our preventative exams, your PSAs, colonoscopies, and mammograms. $50 is awarded for your first claim for those preventative services. We still do have the IQBA Cares medication change incentive, as well as some of the missions and city challenges that are still worth unlimited coins. You can also be entered into the IQBA private sweepstakes for those benefits. We have Teledoc and tobacco attestation for 400 Rally coins. And then if you participate in the clinical rewards program that we'll be discussing later, you have an opportunity to earn 500 Rally coins per quarter, equaling 2,000 coins for the plan year. And so we also did want to mention just a fun feel-good fact regarding the coins. I know we hear a lot that the coins are not worth much, but the IQBA members donated more than 4 million coins to charities last year. So that's a very, very big accomplishment. So we really hope that you enjoy these enhancements that we put in place for you this upcoming plan year.
Another enhancement that we're introducing is the physician results form. That means that there's no more finger pricks or additional blood draws. starting in April, IQVIA members can get credit for a biometric screening just by visiting your physician. So you'll still log into the same Quest portal, which you did previously to schedule an on-site event or a patient service center appointment. You'll log into this portal and there will be a new option for you next to number 1 where you can print your physician results form. From here, step 2 is to just download the form. The form will contain a barcode that's unique to you as the employee or your spouse that's covered by the plan. It is important that you do not make copies of this form and share it with your friends because, like I mentioned, this form is unique to you as an individual. Step 3 is just visiting your physician's office for your annual wellness exam where blood work is also included. When you visit your office, your doctor's office, and they do complete your annual blood work, the section next to the number 3 and circled in red is the portion that your doctor will complete and ultimately sign the form. The submission step is the last step. Your physician can fax the form directly to Quest Diagnostics, but we're encouraging all of our members to request a copy of the signed form just in case it doesn't get uploaded. We know that doctors' offices can be a little crazy, and we don't want to rely on the front desk staff to, handle our biometric incentive for us. So if you request a copy of the form, you can always upload it or fax it on your own.
Also want to review some rally reminders of some of the programs and incentives there for you. First is the Rally Clinical Rewards for Chronic Conditions. The Clinical Rewards programs provides our members who have chronic conditions with some additional educational resources and materials. We have listed here on the screen for you the conditions that can qualify for this Clinical Rewards program. If you choose to participate, you'll get, as we mentioned earlier, 500 coins each quarter that you complete and you achieve your goals. And then next is the city challenges and the private sweepstakes. We're still doing this. IQVIA gives away $50 Amazon incentives. You can earn your chance to be entered when you participate in the city challenges and you cross one of the milestones. You don't have to necessarily win the challenge, but each time you complete a milestone, you'll be entered into the drawing to win that incentive.
So what is the value of the improvements that we've made to the Rally plan this year? Everyone is familiar, I'm sure, with Emma. So we've used Emma as an example in our presentation today. So next year at open enrollment, we hope that this will be Emma's story. By next year, Emma would have downloaded the Blue Cross Blue Shield mobile app and she was able to locate a Blue Distinction Total Care provider. Through that provider, she was able to get her annual physical for free at no cost to her, and she was able to earn $60 for that wellness exam. Her primary care physician also submitted the Quest results form, the Quest physician results form for her biometric screening, earning her an additional $40. So just by visiting her primary care physician, Emma is already at $100 that are redeemable for those electronic gift cards. Then at work, Emma participated in 5 on-site events totaling $50. And since there's an opportunity for 2 more, she's really hoping that she can complete those. During a recent visit to her doctor, Emma was diagnosed as diabetic, so she connected with a Blue Cross Blue Shield health coach through the Clinical Rewards program that's in Rally. So this earned her some additional education and helped her control her condition a little bit more. So at this time next year, Emma has already earned 150 Rally dollars redeemable for those gift cards within the Rally platform, and she has donated 8,000 coins to various Rally charities. Keeping in mind, Emma has not done anything out of the norm by this time next year, and she's already earned $150. So if you are one of the people that can also cash in on the preventive services, or you are eligible for a qualified medication change, the sky is the limit next year.
I also wanted to talk about your flexible spending account. We know that this is a mandatory election each year, so you are required to make an active election. We'll first talk about the healthcare flexible spending account. This account is funded by you, the employee, through a pre-tax payroll deduction. The funds in the FSA are available immediately as of the beginning of the plan year. So on April 1st, your total annual election amount is deposited into your account. The funds in the healthcare flexible spending account can be used for medical expenses for you and your eligible tax dependents. If you're enrolled in an IQA medical plan that is in conjunction with your HRA, those FSA funds must be used before you can tap into your HRA. And then your limit as far as your maximum annual election amount this plan year is still $2,000. The FSA is a use it or lose it plan, so nothing will carry over. So you have to plan wisely as far as the amount that you're going to elect each year. Next is the dependent care flexible spending account. So this is for your child care type of account. This again is funded by you, the employee. Unlike the FSA where you get a lump sum deposit, the DCA is a little different. You receive your deposits each time you get paid. So each pay period, you'll receive a deposit into that DCA. Another important thing to remember on the DCA is the funds can only be used for care of your children up to the age of 13. So as of the 13th birthday, your child will no longer be eligible for the DCA reimbursement. So if you have a child that's 12 that's going to be turning 13 within the next plan year, you will also want to plan wisely when you're choosing your annual election amount. And again, that limit is $2,000. So as you're planning for your daycare, your before and after school care, and your summer camp expenses, just make sure that you're taking that into consideration as far as that 13-year-old limit. And then the last part is just more of an FYI. The HRA is paired with your medical plan, so you don't need to enroll or make an election for that HRA as long as you're enrolled in a medical. If your employer funds that account monthly, the deposits are received at the end of the month. There are no deductions from payroll, as I said. These accounts do earn interest quarterly. And again, these funds can be used for your medical, dental, vision, and prescription out-of-pocket expenses for yourself and any other dependents covered under your medical plan. These funds do roll over. So if you don't use all of your funds within that plan year, they'll be rolled over. And after 36 months of you continuously being enrolled in that HRA, you do become vested in those funds. So if you do have to leave the school for any reason, you do have that added protection of still having those HRA funds available to you.
Next, we're going to review dependent verification. Dependent verification is a very integral part of keeping our plan in line. So if you are currently covering dependents that you know are not eligible for the IQVIA plan, they should be removed during open enrollment, and their coverage will terminate as of March 31st. In case you missed this paragraph before you finalize your enrollment, you are certifying on the final I agree button, you are certifying that all the dependents enrolled in your plan are in fact yours. So just keep an eye out for this.
Okay, so who is an eligible dependent? For our plan, it's the legally recognized spouse, your domestic partner. Of course, you must submit an affidavit and have that approved by your employer. Your natural child, your legally adopted child, a stepchild, a child that's required to be covered pursuant to a QMESCO, a qualified medical support order, a child with whom you have legal guardianship and that child resides with you, and a foster child. And under our plan, a child is a dependent until the end of the calendar year, not the plan year, the end of the calendar year in which the child attains age 26. If your child is over the age of 26 and they're disabled, which means they are continuously incapable of self-support because of that disability, we do allow them to remain on the plan after the age of 26.
So where will you go to make all of these elections? You will visit icubabenefits.org, and during your open enrollment period, you're free to update your benefits for the coming plan year. These benefits will remain in effect through the next plan year, April 1st, 2020 to March 31st, 2021, as stipulated by the IRS. So this is an IQBA's rule or St. Edward's rule. Open enrollment is an IRS rule. If you, excuse me, if you need to make additional changes during the plan year, they can only be made after a qualified life event within 30 days after such event. So if you have a baby or get married or have a loss or gain of other coverage, those are all considered qualified life events. So we encourage everybody to at least go in during open enrollment and verify that your current benefits are as you would wish they would be. When you log in to IQBAbenefits.org, at the very top of your home screen, you can simply click Start Your Enrollment button. And then from there, you'll be asked to step through your enrollment period or your enrollment. You'll verify the employee and family information and then confirm all of your benefits and make any changes that you wish. If you do decide to turn Emma off at the beginning, I know that she pops up and asks a lot of questions. So if you turn her off and but you do want to ask her questions later, she can be reset up and she will be available in the corner. And then the final step is viewing, emailing, or printing your confirmation statement.
Next up, we'll talk about our open enrollment sweepstakes. So as you're going through open enrollment, you will be asked to update and or confirm your personal phone number and personal email address. If you update that information or if that information is already there, you finalize the enrollment process and then you're automatically entered into the sweepstakes to win. So as you're going through, it's very important. Just make sure that this information is updated and it is there and you're automatically entered.
So IQBA does a lot to improve access by eliminating barriers to care. So it's really important as you, as the consumer, to be an educated healthcare consumer and understand how the plan pays for certain covered expenses, especially before you're sitting in the doctor's office. The IQBA plans are specifically designed to remove barriers to care by offering plans where the deductible only applies to major services. So we're going to review some of the barriers that we've broken down and some of that ease of access to care in the following slides.
The first barrier that we try to break down is accessing the various brand partner sites. So on the IQBAbenefits.org portal, we do have single sign-on capability for you to the various insurance carrier websites. We have the IQBA Benefits MasterCard, OptumRx, Blue Cross and Blue Shield for your medical, and then Aetna for your EAP and behavioral health. So all of these are on your homepage on that portal, right under the streaming banner, the picture banner. You'll just click onto one of those links. You'll be directly taken to the carrier website. If it is your first time accessing that single sign-on link, you may be asked to register, but going forward after that time, you'll just click on that button and you'll be automatically logged into your account.
Next, we wanted to give you a visual representation of how the plan works at a very high level. In the left column, you'll see all the benefits that are at no cost to you. So all the benefits listed in the left column should always be $0, including visits to your Blue Distinction Total Care primary care visits, colonoscopies, mammograms, any medically necessary labs performed at a Quest Diagnostic, all surgery procedures that are done through a surgery, plus surgical opinion, and including also ultrasounds of the breast. Then in the middle column, these are all not subject to your deductible. So you will be responsible for a copay or co-insurance for the items listed in the middle column, but never your deductible. So items like advanced imaging, visits to your doctor's office for common illnesses, emergency room, outpatient mental health services, physicals, prescription drugs, therapy visits, all of these items in the middle will never be subject to your deductible. In the far right column, we have listed all the major services. These are the items that are subject to that higher deductible amount. So just keeping in mind hearing aids, home health care, any hospital expense or hospital stay, inpatient mental health or substance abuse, private duty nursing, all of these items in the far right column are all subject to the deductible. So it's just important that you be a wise consumer when you're visiting the doctor's office.
Next, we wanted to review your Surgery Plus benefits. This also is paired with your medical plan, so you do not have to make an election for this. If you're enrolled in the medical, then you're automatically enrolled in this plan. So with Surgery Plus, you have access to elite Surgery Plus surgeons. They call them the Surgeons of Excellence Network. They're licensed, board certified, fellowship trained. They've been screened for malpractice, sanctions, and criminal records. We've listed here some of the covered procedures. This list is not all inclusive, but we wanted to give you an idea of some of the more common procedures that are done through Surgery Plus. And then there's a financial incentive for you as the member. If you choose to have a non-emergent surgery through Surgery Plus, your deductible and co-insurance are waived, so the procedure is at no cost to you. And if you are required to travel, there is an additional travel benefit included. So the first step is you've seen your doctor and they've said that you need a surgery. You'll give Surgery Plus a call. They have full service concierge, so you have access to a dedicated care advocate throughout your entire journey. They will locate a list of surgeons for you to choose from. They help with making your appointments, coordinating transfer of your medical records, as well as scheduling any follow-ups after your surgery. So if you do find that you need a surgery, we do suggest that you contact Surgery Plus first to see if you can find a surgeon within their network, and that'll help save you some money.
Teladoc is still a very popular benefit at only a $5 copay. This is a telemedicine or video consultation that is available to you at any time. So if your doctor is unavailable, you're at work, or you simply just don't have time to get to the doctor's office, or you're on vacation or a business trip, these are all great times to call Teladoc. Some of the top diagnoses are listed here on the screen for you. If you notice, these are the more minor illnesses, including sinus problems, ear infection, upper respiratory infection, something that you can easily describe to a doctor over the phone. The doctors are able to write prescriptions as needed for the more minor illnesses included. If you have lower back pain, keep in mind they are not able to write controlled substances or lifestyle drugs. So just if you are coming down with something that you can easily describe to a physician over the telephone, that is a great time to call Teladoc, and it is only a $5 copay.
Next, we'll discuss the IQVIA Cares Pharmacist Advocate Program. We have here on the screen some of the questions of maybe why you would contact IQVIA Cares. You have side effects from a new medication, or you were denied at the pharmacy for a prior authorization, and you've misplaced that letter that Optum mailed to you. Were you told that you need to try step therapy before you can take a certain drug? Or you just want to learn how you can save money by switching to a generic? These are all great reasons for you to call IQVIA Cares. They're available Monday through Friday from 9 a.m. to 5 p.m. They are real pharmacists, real advocates with real solutions for you. So we just suggest or really hope that you call them just to get what we call a medication checkup. If you know how you're doing, maybe you're having some side effects that you're not really sure which drug is causing that, give IQVIA Cares a call. They're really great, and they really do advocate for our members.
Next, we're going to review the Able To program through Aetna. This is a condition management program that provides free weekly sessions. The health and life conditions that are outlined on the left side of your screen are some of the conditions that they target or can really assist with. This is a web-based video conferencing or telephonic appointment structure depending on what you choose. The appointment frequency is once a week with a therapist and once a week with a behavior coach. So 2 appointments each week for a total of 8 weeks. Over the 8 weeks, you'll learn how to address emotional challenges. You'll also work to identify health goals and develop an action plan. And the learning doesn't end at the end of your 8-week session, at the end of the 8 weeks or your 16 sessions. This program is really meant to spark behavior changes and really help you learn how to cope with the health or life instances that are outlined on the screen. The information that you learn through this Able To program, you will carry with you for a lifetime.
Next is the health management and care consultants, as we mentioned earlier, about providing your phone number and email address. So if you were to get a call from someone, they're calling because they care. So there are trained health advisors from our brand partners such as Blue Cross and Blue Shield, OptumRx, Aetna, or even IQVIA Cares. They're, again, trained health advisors and registered nurses providing tools, education, and they can advocate for you to help you manage your chronic health conditions. They can help you set goals, help you understand maybe a treatment plan that your doctors prescribe. They can help support you with referrals, transitions to care, and they can even help assist in any gaps in your care that you may currently have. So if you were to get a call, we just really suggest that you answer that call so that you can work with one of these individuals to help you manage your condition.
Next, this is just a reminder, all visits to a primary care Blue Distinction Total Care provider are always $0. So if you're in the market for a new physician, make sure that they have this designation because all medically necessary services received from a Blue Distinction Total Care, family practice, internal medicine, or pediatrician, regardless if they are a wellness exam or a sick exam, are always free. On the other side of the screen, we are reviewing the Care Connected, which is Blue Cross Blue Shield's version of customer service. They can assist with claims questions. They can help you with billing. They can even find you one of those fancy Blue Distinction Total Care providers that I talked about on the other side. They can also connect you with a lifestyle coach or a chronic condition coach. And again, this number is the Blue Cross Blue Shield customer service number. This number can be found on the back of your Blue Cross Blue Shield ID card. It is not listed as Care Connected. It is listed as customer service, but we just wanted to remind you of this great benefit.
Next is the Blue Cross and Blue Shield app. It's the My Health Toolkit mobile app. We did touch on this last year, but we just wanted to review it with you and some of the great benefits that they have. By downloading this mobile app, you have access to your ID card, your claims. It will describe and give a listing of your benefits and their coverages and much, much more. You can download the app. You'll use the same user ID and password that you established from your IQVIA single sign-on. What's great about this is once you've logged in, you can save your ID card to that app home screen. So if you're in a doctor's office and you need to provide a copy of your ID card, you don't need to log in. You can just pull that ID card up from your home screen. The app does have Touch ID and facial recognition login capabilities. And what's great about it is you're getting your benefits and your information in real time. So it's up to date and accurate. And this app is also integrated with Rally. So you can access your Rally benefits directly from this app as well.
Next is the Employee Assistance Program. So you do not need to be benefits eligible or enrolled in the IQVIA plan in order to take advantage of the Employee Assistance Program. The 4 key items that people usually or most commonly call resources for living for are noted on the screen. So any emotional support, which is connecting you or a family member or in your household to 6 sessions per issue per year with some face-to-face or over-the-phone counseling. Next is a life situation. You can obtain referrals for services for you or your dependents at any time. It's like having a personal assistant available to you whenever you need. And then legal, of course, is also great. They have a wide array of legal needs and consultations that are available for you, a wide variety of legal documents that you have access to, including a will, or if you are having trouble with a tenant. Those are all great reasons to call the Resources for Living for some legal advice or assistance. And then with tax season coming up, we always just want to remind you that they do have a financial sector that can help regarding budgeting, retirement, or, tax season is right around the corner. So all calls made to Resources for Living are free and confidential. We hope that you'll make good use of this benefit.
And also we want to talk about TalkSpace. EAP has gone digital. So with TalkSpace, it's an online therapy platform that makes mental health care more convenient and accessible by connecting you with a licensed therapist right on your phone. On average, 1 week of TalkSpace messaging equals 1 EAP session. So you're allowed to send unlimited multimedia messages like text, audio, pictures, and videos to your therapist via your web browser or the Talkspace mobile app. Those experts can communicate back with you back and forth. It usually takes about 1 working day for a response during their normal business hours, which is 5 days per week. So your first step to access this benefit is to call Resources for Living for that authorization. After that time, you can register on Talkspace.com/RFL. You'll put in your organization name, which is your school, St. Edward's School, and you'll be connected with that therapist. So this is only at this time available to adults who are over the age of 18. So your minors can't participate in this now, but this is just an additional benefit for those of you who are not tied down to your computer or you don't really like to talk on the phone that much. You do have this option available to you as well through Talkspace.
Next, mobile apps can help break down barriers as well. So if you don't already have an iCuba folder built out on your phone, we encourage you to download these mobile apps. They can help you in a pinch. It's like having the insurance carriers in your pocket, at just a click away. So if you have not downloaded them, please do so.
And then we do have some great news. You will have the same great benefits from these brand partners listed here on the screen. That's Blue Cross and Blue Shield, Optum Rx, Aetna, your Guardian dental benefits, as well as Symetra. We'll review these plans with you, but the good news is there's not a lot changing with these plans for the upcoming plan year.
The first is Blue Cross Blue Shield, Optum, and Aetna through our medical plan highlights. This is just a snippet of our in-network benefits only. The preferred PPO and the $4,000, $8,000 deductible PPO plan will continue. And as we mentioned, there are no changes to the plans this year. I will highlight that the preferred PPO does have the lower deductible, lower than the $4,000, $8,000 deductible plan, and a 20% coinsurance with a copay structure, while the $4,000, $8,000 has a slightly higher coinsurance and follows a copay structure for many of the doctor's visits.
Okay, those were the similarities. Now we'll talk about some of the differences, in particular with the $4,000, $8,000 deductible PPO plan. This plan was really designed for freedom for healthy families with children. This plan does provide a premium cost savings for those healthy families with children. You have the freedom to choose a plan that meets your needs, freedom to shop for pricing for the services you want, freedom to visit the providers of your choice. And also with this plan for the upcoming plan year, there's a $0 increase for the employee plus children and the family tiers of coverage. So we really just wanted to hone in on some of the differences in this plan offering. The deductible and out-of-pocket for this plan is significantly higher than the preferred PPO. Your coinsurance and your copays are also higher. While the plan premiums are much less, if you experience a catastrophic event, this plan may end up costing you more. So we just wanted you to be aware of this plan and some of the differences that are out there. While you do have the same great core benefits that don't apply to this deductible, you do have that same Rally well-being incentive, the same prescription drug benefit. We did just want to point out some of the differences of this plan so that you can be an informed consumer as you're going through your open enrollment instance.
The iCuba prescription drug plan is not changing. We still have the tiered structure with the various copays depending on your drug. Just to highlight that we do offer 30-day retail only, and a 90-day supply within retail or mail order will save you money. So if your prescription is eligible for a 90-day supply, we really encourage you to take advantage of the savings that come with that larger supply. We do want to highlight some prescription drug freebies, which are highlighted on the bottom left corner of the screen. These prescribed medications or diabetic supplies can be received at no cost to you. The statins, you must be eligible for the statin coverage, but if you do see a drug that's listed up here, make sure that you have a prescription from your doctor, and the pharmacist at the counter will be able to help you. We also have an additional prescription drug out-of-pocket maximum. If you are someone that takes a lot of prescribed medications. However, you're not frequently at the doctor's office. We have this out-of-pocket maximum built into the prescription plan as an added layer of protection for you.
We also wanted to touch on your Aetna benefits, your behavioral health and substance abuse. You have professional counseling. You can speak with a licensed clinician to help you manage your diagnosed behavioral conditions. Again, that's available by phone, televideo, or in the office. Can prescribe psychiatric medications and get evaluations for that. They can help you manage your medication, or maybe if you need to be diagnosed, they can help you with that. They also have an applied behavioral therapy analysis benefit. This is for those autism diagnoses, and also intensive services benefits for those hospitalizations, detoxifications, and residential treatment. You'll just call Aetna. The phone number is outlined here at the bottom of your screen. We talked about EAP earlier. They have the same phone number for both of those programs. EAP, you'll press option 1, and if you do need any of these behavioral health or substance abuse benefits, then you'll press option 2.
Symetra covers your income protection benefits. So you do have basic life and basic AD&D available to you, as well as voluntary life, spouse life, child life, and long-term disability.
Also on the life and disability through Symetra, we just wanted to touch on evidence of insurability. So during open enrollment, you may have the opportunity to increase your life and disability coverage. So if you have this guaranteed issue amount, if you go above that, then evidence of insurability is required. As you're going through your enrollment, you'll receive this notice here that's on the screen with an action required. So this EOI process must be completed directly following your enrollment, and coverage must be approved by the insurance carrier prior to this coverage being active. So if you do have to complete this EOI, we just advise you to do the best you can when you're completing that questionnaire. You'll have a SSO connection directly to Symetra that you'll initiate after you completely finalize your open enrollment selections. Again, do your best to answer these questions. This will be your only time to complete this process. If Symetra has any questions or they need additional information, then they can contact you directly.
Some open enrollment housekeeping items. We just wanted to reiterate that all changes made during open enrollment will remain in place for the full plan year. So from April 1st, 2020 to March 31st, 2021. This is an IRS statute, so we cannot deviate from the open enrollment time period. Any changes made outside of open enrollment are only permitted within 30 days of that qualified life event. As a reminder, the 1095 tax reform will be safely saved in your employee file. This tax form is not required this year to file your taxes, so we'll just keep it for safekeeping in your employee file. All requirements of healthcare reform are in place. In fact, IQA plans offer more generous free wellness benefits than are required by law. And in addition to verifying all your current benefits, now is the time for you to review and update your life insurance information, your beneficiary information. So just as a reminder, if you're designating a beneficiary who is under the age of 18, you might want to contact an estate planner or establish a proxy or trust.
And then it's the end of our presentation, so we'd just like to thank you for all your attention today. We're so excited about our 18th year of continued service to all of our 27 members. So thank you for listening to this presentation, and we wish you well.